Hi, thanks so much for having me come to speak here today about my scoping review that is looking at area level deprivation and risk on stillbirth. No. So as many of you here know today, deprivation is basically a measure of disadvantage experienced by a person or their community considering their economic and social well-being. A deprivation index tool measures how disadvantaged an individual is based on the characteristics of the area in which they live. Deprivation has long been associated with health inequalities and has been linked to poor perinatal outcomes, with babies of women from deprived areas twice as likely to be stillborn, as per a recent Embrace report. So my scoping review aimed to provide a descriptive overview of the literature available on the relationship between area level deprivation based on composite measures and stillbirth in upper middle to high income countries. The Joanna Briggs Institute methodology was used and 6 scientific databases were searched, the results of which went through a full screening process. The relevant data was extracted and the data was organised, synthesised and presented in a narrative summary. The results then showed a total of 29 studies were included for review, the years of which ranged from 1998 to 2023. 9 countries were included, as you can see here in the map, the vast majority of which were UK-based. The stillbirth definitions within the studies varied across the gestations, and a wide range of deprivation indices were used, 18 in total. These are the 4 most common indices that were used, and they were all UK-based, which is reflective of the vast majority of the studies being based in the UK. The most common measures that were included in the indices across all of them were employment, housing, education, income, safety, and access to facilities and services. 22 of the 29 studies did demonstrate that a higher risk of stillbirth was associated with areas of higher deprivation, and you can see here the range of the degree of the effect throughout the studies included. The remaining studies did not show an association between stillbirth and higher levels of deprivation. So to reflect on those results, deprivation can be described as complex, multidimensional and beyond individual control, which is mirrored by the World Health Organization social determinants of health, which have been seen to massively influence health equity and more than lifestyle choices alone. So to conclude, this research can hopefully help us understand deprivation-related risk, highlighting inequalities and encouraging equal maternity care. The key message to take away is that a woman's level of deprivation based on the characteristics of the area that she lives in can impact her risk of experiencing stillbirth in upper middle and high income countries. Focused initiatives aimed at reducing stillbirth among women at higher deprivation related risk is needed. Thank you so much for listening.